Hello, my dear students. I am Ayushi Patud, lecturer at GRYIP Institute of Pharmacy, Borama. Today's session on Code of Pharmaceutical Ethics in relation to his job. Before forwarding towards the session, let me explain you what is ethics and what is pharmaceutical ethics. Ethics are the rules by which a profession regulates actions and sets standards for all its members. The ethics in relation to pharmacy profession is called pharmaceutical ethics. It is the branch of philosophy that is concerned with the moral values of right and wrong in human behavior. Code of Pharmaceutical Ethics is formulated by PCI, Pharmacy Council of India, for guidance to Indian pharmacists. The Code of Pharmaceutical Ethics helps to guide the pharmacist as to how he should conduct himself in relation to his general public, with medical profession or with health profession. Let's come to the topic. Pharmacist in relation to his job. With relation to job, the pharmacist should follow the following ethics. First, scope of pharmaceutical services. Premises registered under statutory requirements and opened as a pharmacy should provide complete pharmaceutical services, including the supply of frequently asked medicine without delaying. It also involves the readiness to provide all time emergency services. It means pharmacy premises should be registered. Emergency medicines and common medicines should be supplied to patient without any delay. Second point, conduct of the pharmacy. The pharmacy should be in such a condition that the risk of accidental contamination in the preparation, dispensing, and supply of medicines should be avoided. The professional character of pharmacy is reflected by the appearance of the premises. Therefore, the public should be made content with the fact that a pharmacist is practicing pharmacy in an establishment. It means the error of accidental contamination in the preparation, dispensing, and supply of medicine should be checked in a pharmacy. Appearances of premises should reflect the professional character of pharmacy. Third point, handling of prescriptions. The pharmacist, on receiving the prescription presented to him for dispensing, should not discuss or comment over it with respect to the merits and demerits of the therapeutic efficacy of the drugs prescribed. The pharmacist, on receiving the prescription, should not show any expression of alarm or astonishment because it may cause anxiety in patient and may also hamper their confidence in the physician. It means pharmacy should receive a prescription without any comment on it. That may cause anxiety to patient. No part of prescription should be changed without the consent of the prescriber. In case of changing RX or prescription should be preferred back to the prescriber. Fourth point, handling of drugs. All necessary steps should be taken to dispense the drug in a correct manner. All the ingredients with the help of scales and measures should be weighed in a correct proportions and visual estimation should be avoided. It means a pharmacist should always be dispense correct and carefully with the standard quality of drug. Drugs that have abusive potential should not be supplied to anyone until prescribed so. The pharmacist should never fill the prescription with spurious, standard, and unethical preparation and should always use standard quality drugs and medicinal preparation. Otherwise, spurious and substandard drugs quality drug is used, it can lead to the serious effect on the health of the patient. Poisonous, abusive, or addictive drugs should be dealt with full care by pharmacists. This preparation should not be supplied until, as I said before, that until it is not prescribed by the physician, it should be not prescribed. Fifth point, apprentice pharmacist. When a pharmacist is in charge of a dispensary, drugstore, or hospital pharmacy where intern pharmacists are trained practically, he should provide the trainees with all the work facilities. This is done so that the trainees, after completing their training, have gained sufficient technique and skills to become responsible pharmacists. The trainee is not granted a certificate if all the criteria are not fulfilled and he she has not proved themselves worthy enough. It means experienced pharmacists should provide all facilities for all practical training. Until and unless the apprentice proves himself or herself, certificate should not be granted to him or her. Thank you.